For our first video for our Transitioning to Adulthood series, I would like to go over spays and neuters in your pet. I know everybody's getting puppies right now, so this is a surgery that you should be expected will be recommended by your veterinarians here at Good Vets. However, if you want to have an open conversation about that, we're definitely willing to, and I'm hoping to clear up some misconceptions and some other questions that you might have related to this procedure as well. Spaying and neutering, typically, especially here at Good Vets, we perform once they hit 6 months of age. The reason being that this is usually before their first heat cycle and before most male puppies will start marking, humping, doing things they're not supposed to. This procedure, when it's performed here at Good Vets, we do preoperative blood work to establish or look at their kidney and liver function and make sure that it's normal and nice and healthy to undergo anesthesia. Once we have that, we can schedule the procedure. They are fasted overnight, just like any surgical procedure. Brought in the morning, we place a catheter, do their physical, give you a call to let you know how everything looks for that morning. Once the procedure is done, we give you a call and let you know how everything went, and then they go home later that evening with a cone to prevent them from licking or biting the incision, and also some pain meds so that they feel nice and comfortable for the next few days as they're healing. An incision recheck is not always required. Sometimes you guys can just send us pictures or bring them in. You want to monitor that, of course, for any heat, redness, pain, or swelling, but most pets do just fine, and a recheck can be done in 10 to 14 days, and then they can go back to being wild and crazy with all their friends. The reason that we recommend spaying and neutering in pets is one, of course, because of the overpopulation issue, pets in shelters, things like that, and the lack of control of breeding in dogs and cats. Another reason is to prevent different kinds of neoplasias or cancers. So with intact females, so when we're talking about spaying, mammary gland carcinoma is the #1 neoplasia or cancer that they will get. Spaying a dog before her first heat cycle decreases her chance of getting this cancer to 0.05%. If you wait until after her first heat cycle, it increases to 8%, and if you wait until after the second heat cycle, 26%. So it kind of increases gradually with each heat cycle that you see. Of the cancers that these pets get, so for intact female dogs, it is seen that 50% of those are malignant, so that they have gone to different parts of the body as well. For our male dogs, so that would be a neuter procedure, it is seen that both with males and females that doing a gonadectomy or spay or neuter is going to increase their life expectancy. Now, some people are concerned with male dogs that they might have an increased predisposition for other things, orthopedic issues like a cranial cruciate rupture, which is a torn ACL in dogs, or other types of like bone cancer, things like that. We have to take all this with a grain of salt, keeping in mind that these pets are living longer, so they're more likely to get different types of cancers that are not associated with their gonads or like their testes or ovaries. Also, there is a couple research studies that has connected in Labrador retrievers. If you neuter them before 6 months of age, they can be more prone to a cranial cruciate rupture. So that's why we do wait until 6 months for both of these procedures to be performed. As always, if you have any questions or need some clarification, or you're just not sure this is something you want to do, we're always open to a conversation, and we want to do whatever you are comfortable doing and what's best for your pet.